Hi, I'm Anita Zacharias, and in this video segment we will look at the anatomical spaces associated with the skull and also their communications. Let us now look at some of the anatomical spaces associated with the skull. Seen with regards to the interior of the skull would be three fossae, and based on their positions you would refer to them as the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. Also associated within the petrous part of the temporal bone, which is not seen here since it is seen inside the petrous part of the temporal bone, would be the tympanic cavity or the middle ear cavity. Once we open up the frontal bone here, you will also see the orbit. The orbit is better visualized in an anterior view of the skull. So seen in this view of the skull, you can clearly identify the orbit. Seen in a lateral view of the skull would be two anatomical spaces. The first one seen above the zygomatic arch, and this one is referred to as the temporal fossa. And if I pass the knitting needle below the zygomatic arch, then I would lead into the infratemporal fossa. Let us now look at the communication between the temporal and the infratemporal fossa. Let's use a pipe cleaner and take it from the temporal fossa beyond the zygomatic arch and medial to the ramus of the mandible. The pipe cleaner now lies in the infratemporal fossa, which is an anatomical space that lies medial to the ramus of the mandible. You can also identify the infratemporal fossa from an inferior view of the skull. And in an inferior view of the skull, you can see the pipe cleaner just lies medial to the ramus of the mandible, and this space, both on this side as well as the opposite side, is the infratemporal fossa. Let's now try and apply two anatomical principles to the anatomical spaces associated with the skull. You could use principles A1 all the way to A6. I have used two examples here. Principle A1 states an anatomical space is defined by boundaries and has openings for communication with other regions of the body. And principle A4 states the functions of a space relate to the structures within it or passing through it. Let's now try and apply these principles to the first anatomical space. We would use the middle cranial fossa here as an example. The boundaries of the middle cranial fossa would be the lesser wing of the sphenoid anteriorly. If you look at the bony boundary posteriorly, then you would see that it's bounded by the petrous part of the temporal bone. Medially, you would see the body of the sphenoid, and laterally you would see parts of the temporal as well as parts of the parietal bone. The middle cranial fossa, if you look at this image superiorly, would lodge the temporal lobe of the cerebral hemisphere. Let's use one more anatomical space and try and apply this principle. So the anatomical space that we would use here would be the temporal fossa. If you look at the boundaries of the temporal fossa, you would find the temporal lines that bound it superiorly. You would see two sets of temporal lines, superior and inferior. If you trace the boundary anteriorly, you would see parts of the frontal bone and parts of the zygomatic bones. Inferiorly, the temporal fossa would be bounded or limited by the zygomatic arch. Seen within the temporal fossa would be the large temporalis, which is a muscle of mastication. Now that you have looked at the anatomical spaces and their boundaries, let's look at a few of the communications of these anatomical spaces. The foramina that we will use as an example would be the optic canal. The optic canal is an opening that is associated with the sphenoid bone. We will make use of pipe cleaners to look at the two anatomical spaces that the optic canal will communicate. So let's pass the pipe cleaner through the optic canal. And once you pass the pipe cleaner through the optic canal, the first end of the pipe cleaner will be seen in the first anatomical space that the optic canal begins in, which would be the middle cranial fossa. And if we look at the anterior view of the skull, then the pipe cleaner will lead into the second anatomical space, which would be the orbit. So the optic canal will communicate the middle cranial fossa with the orbit. The second example that we would use to apply the anatomical principle would be the jugular foramen. The jugular foramen, unlike the optic canal, is not seen within one individual cranial bone. It is seen between two cranial bones. The anterior cranial bone that forms its boundary would be the temporal bone, and seen posteriorly would be the occipital bone. We will use the pipe cleaner once again to identify the two anatomical spaces that the jugular foramen communicates. So if I put the pipe cleaner through the jugular foramen, you can see that the top end of the pipe cleaner lies in the first anatomical space, which is the posterior cranial fossa. And if we look at a lateral view of the skull, you will see that the pipe cleaner has now reached the neck. So the two anatomical spaces that the jugular foramen communicates would be the posterior cranial fossa and the neck. The next foramen that we will consider is an oval-shaped foramen, as you can see here, and this foramen is called as the foramen ovale. The foramen ovale is situated in the sphenoid, quite specifically in the greater wing of the sphenoid. Let's now look at the two anatomical spaces that this foramen communicates. We will pass a pipe cleaner through the foramen ovale, and you can see that the top end of the pipe cleaner is in the first anatomical space, which is the middle cranial fossa. And if we look at a lateral view of the skull, you can see that the pipe cleaner has now reached the infratemporal fossa. So the two anatomical spaces that the foramen ovale communicates would be the middle cranial fossa and the infratemporal fossa. I would now like for you to identify two foramina, name the parts of bone that they're situated in, and also name the two anatomical spaces that these two foramina communicate. So foramen number 1 is seen just posterior to the foramen ovale, as you can see here. And foramen number 2 is this foramen here. The foramen is situated in this part of the cranial bone and is seen just above or superior to the jugular foramen. Please post your answers on the discussion forum. You have just identified some of the foramina associated with the skull. Let's now look at the structures that traverse these foramina. So let's look at the optic canal first. You've already identified this foramen. You've seen that it's located within the sphenoid bone, and you've also identified that it communicates the middle cranial fossa to the orbit. The structure that passes through the optic canal would be the optic nerve. Similarly, let's look at the foramen ovale. Again, you've already identified that it's situated in the greater wing of the sphenoid, and the two anatomical spaces that this foramen communicates would be the middle cranial fossa and the infratemporal fossa. The structure passing through the foramen ovale would be the mandibular division of the trigeminal nerve. Please note that there would be other structures that also pass through the foramen ovale, and I've only listed one of them. You can use this image to identify the various foramina in the skull and also look at the structures that pass through these foramina. It is best to identify these foramina starting from anterior and running all the way posteriorly. I have named the foramina for you in red, and you can relate it back to the structures that pass through them. So for example, the most anterior foramina that you see here would be the olfactory foramina. The olfactory foramina are seen within the ethmoid bone, and they will transmit the olfactory nerves. If I trace the skull posteriorly and I reach the petrous part of the temporal bone, then you can identify the internal auditory meatus. Passing through the internal auditory meatus would be the facial nerve and the vestibulocochlear nerve. The most posterior foramina that you will identify, and also the largest, which has not been named in this diagram, is the foramen magnum. The foramen magnum will transmit the spinal cord, as you would see in this image, and it also will transmit two important arteries that enter the skull, which are referred to as vertebral arteries.